So I don't mean late start in that I'm a day late. I'm normally here Mondays with my workouts. But today I'm very excited to be offering a new product, introducing it on behalf of Lifepro. It's Tuesday, and wherever you are joining me from, if you are, please let me know where you're from. I'd be very curious for those of you that are joining me today, if you are familiar with Lifepro's light therapy products, if you're using any now. There's been a huge expansion in the lineup of the products that they offer. And today is what I would refer to as a specialized tool. Today we are talking about the BioCare, and we're going to be giving one away. So at the end of today's session, if you are here joining me and you would like to be entered for the draw to win the BioCare, if you are in the USA, please make a comment, and anyone that makes a comment and participates today, we will draw a name at the end of the session to let you know who's taking this bad boy home. And for those of you that are using red light therapy with Lifepro in particular now, I'd love to hear what products you're using, what you're using them for. What I want to talk about today is can be a general tool. We get a lot of questions about, can I use this for that, or is this okay to use for that? In theory, good morning, Irene. Nice to hear from New Zealand. Hello. I appreciate you joining us. And hello, Alicia. So red light can be used for a lot of different things. There's a huge spectrum of frequencies, even just within each of the colors. There's red light, there's blue light, there's amber lights, there's green lights. Today, we're talking specifically in the red spectrum. Like vibration machines, it's never one particular frequency or speed. In the light world, there's lots of discovery of positive benefits, but the nanomes that you see referenced in the studies are kind of all over the place. So I always like to speak in ranges. You don't necessarily need to have a device that does the exact specs in a study, but you do want to ensure to achieve the benefits, you're getting something within those ranges. So because Lifepro has a lot of products, I've kind of gotten some information. I want to talk about a few benefits today. I've done a number of sessions on red light therapy, and there's some really great blog articles that Lifepro has on their site. So I'm asking my girl Lauren behind the scenes, and her super dog Olive. She's going to post throughout the session today a couple of links. One of them is going to be a link back to a blog article, and there's some scientific references. But the reason I'm honing in on that one study is it's more specific to today's product. It's an older article, but the benefits of treating red light therapy on your face, using it as a treatment. There's a number of different reasons, which I'm also going to get into. But I wanted to give you a little bit more substance without having to rehash past sessions if you've listened to me ramble about red light a few times. But just to highlight, what we're talking about today is a handheld tool. There's different types of red light devices. Some of them are more hands-free than others. This one is going to be ideal. Perhaps you're trying to ramp up results or spot treat a very specific area, and it's ideal for the face. Some of the other devices, if you've got the belt or the panel, or some of the bigger devices, they're going to be great for treating bigger areas. They tend to be longer treatment times, more relaxing treatment times. This is what I personally, there is really no classification over types, but I always have to put things into types to help better explain to you what might better suit for your application. Again, if you're joining me today, we're going to be giving one of these away. So please make sure you make a comment. I'm going to get to some questions at the end of the session. Today's tool, the BioCare, is very similar to the LumaCure. You can use it in a similar fashion. So what I've done is what's unique about this one is it's got a separate attachment. And what it does is this is an attachment you take apart. I better show you how this works. So in the box, I'm going to show you before I turn the light on. In the box, which I have here, it comes, of course, with an awesome carrying case. The device itself looks very similar to the torch. You can see in the inner housing, the difference between this and the torch is there is a single, very intense diode, whereas on the other ones, you're using it in this fashion. This comes with an attachment. So what you're going to do in the box, when this thing comes, there's a little piece here that you're going to need to remove. It shows in the instructions to allow you to attach the additional little attachment that's in here. Just screws in. This is again steel. That word I like to use is substantial. Okay. And what else comes? This is again lithium battery, one of which I have already charged and inserted in the device. You also get a second battery. What I love about these smaller specific devices, the high intensity ones, is they're perfect for taking with you. And if you're not going to be near a charging station, but you got about 3 to 4 hours use in one of these batteries. So you could use the thing on and off all day, or if you're a practitioner and you're using it to treat a specific area, maybe in complement with something else you're doing, it's probably going to last you more than the course of a day or two, as far as the rechargeable batteries. So it really makes it a multiple use device that way. It also comes with glasses. So of course we need to protect our eyes. If we don't want you looking at this, and even though we always have the best of intentions, we have a tendency to look at the light just like a bug. So there are glasses. If you do not own a pair in a past red light device with LifePro, there is a pair included in your case. So you've always got a pair ready to go with you. There is a cleaning cloth for the lens as well. I guess you could use that on the glasses. There is a wrist strap. So, maybe you're going for a walk, or you don't really have a purse or something with you and you want to take this with you. It's got an attachable wrist strap that you can put in there. This all tucks back into the box. Voila, I have assembled it. I'm going to zip this back up. And I want to get into a little bit about why you would want something like this over other red light tools. So we get a lot of questions about, maybe you own the Aliva Red belt, or maybe you own one of the saunas, but sometimes we have certain areas, maybe it's a particular joint. In the instance of what I'm demonstrating today with this new BioCare, maybe you've got a pimple, or maybe you've got a cold sore. I know that LifePro is marketing this as a cold sore device, but really, if you think outside the box, yes, red light's a universal thing, but I would say this is going to be ideal if there's visual areas you're keeping an eye on. I've got some really bad scarring from acne. Without going in for some surgery, I probably wouldn't get rid of all the scars to begin with, but I have been using the VisiCure, but this would be a good way to ramp up. Maybe there's a couple of sunspots. As I said, they're marketing it as a cold sore device, which it's going to be ideal for. But I'm also thinking, what about gingivitis? Maybe you've got a lesion on your gums, or perhaps you scraped up your face when you fell off your bike this weekend. So this would be a really good way to complement other red light devices you have, or if you've got a specific area on the face, the neck that you want to target. You could even use it for if you don't have the LumiCure and you've thought about considering it. The biggest difference with this tool and the LumiCures in comparison to the other red light devices is its accelerated treatment time. It's a much shorter treatment time. This isn't something you're going to use to accelerate weight loss or target cellulite. This is designed to target and spot treat a specific area very quickly. That's going to be critical if you're treating pain. I've already had a couple of my friends ask me, can I use it for my migraines? Can I use it for my headaches? In theory, yes, you could, because red light is known to improve and help with the treatment of migraines and headaches. Would I put it right on your eyes? No, but you could use it on the temples. I've read that if you're treating for tension headaches, you're to put it on the forehead. So the simple operation of this, there's one setting at 690 nanohms. It's within the red light spectrum. Let me refer back to my notes. The red light spectrum, the wavelengths range between 620 and 720. So this is bang in the middle. The BioCare is right in the middle at 690. And as I said, think of this as a tool to target specific areas. And I think if you are a practitioner, or if you're treating someone else in your home, you're caring for someone, it's a nice little handheld alternative. It weighs very little. If you're dealing with grip strength or poor, neuropathy, things like that, this is a very easy tool to hang on to. It's not very heavy and encumbersome. So there's never one perfect tool for everything. I'm just giving you some ideas here. On the front of the unit, there's a very prominent button. And to operate this, all you do is press the button. This will run for a 10-minute period. You can see that I've still got what's called the protective sleeve on this. So if you're doing full treatment, there's a little red cap just keep that lens clean and you can see it reflecting there. Okay. If I were to turn it on, okay, you can see it. It's directly on the skin surface. If you pull it away, you can see that it's casting the beam on a little bit of a larger area. So let's say I wanted to treat, one of these areas on my face. I'm going to use my camera as a mirror. You could just literally hold it on that pimple or that scar tissue. As I said, LifePro is marketing this. It comes up as the cold sore device. So if you are dealing with a cold sore, perhaps you've got some gingivitis, something you want to treat. It gives you the ability to sort of point the light in a more specific area than if you were the Lumicure itself. There's going to be more risk of you looking at it. And I found what I was playing, I just got this yesterday, and what I was sort of playing with, I do use my Visicure. I need to use it more consistently. I'm always nagging you guys. That's the one thing I got to stick with more is my Visicure mask. But I do have some really bad scars, and I've got some sunspots because I'm always in my garden. And I notice now that I'm 50, I turned 50 this last weekend. There's like a spot here and down that is darker and spotted. So, I could use this to more finely target those sunspots. Maybe you just got your ears pierced and you've got a little bit of an infection. You could target that little area without, the Lumicure itself, the other version of this. I love the Lumicure. But I think, that this is a little bit different in its design. Oh, thank you very much, Cindy. But I think you're going to find if you like your Lumicure and you like the accelerated treatment times, I gave Laura, excuse me, I was in the garden before I came out. It's beautiful here today, still in Canada. I created my cheesy little recommended treatment times. Again, there's no perfect cookie cutter for every person, and there's recommended treatment times in the booklet, which is also in here. But I want to show you a specific part when you start looking. This is going to be in all of your red light therapies. This is me changing things on LifePro. So you're going to see this chart here in all of your red light books, and it's going to talk about the frequency and the duration of using these types of tools. So there's two basic types of tools with LifePro in the light therapies. There's going to be the high intensity. I don't know if that's the best word, but that's what I'm using today, is the short treatment time. So 1 to 5 minutes. I know this goes for 10, but you can treat more than one area. If you're going to use it more than the preset time of 10 minutes, give it a break. Give it 2 to 3 minutes. It's high intensity. This thing's going to get warm. To prolong the life of your device, you want to make sure that you're using it within recommended guidelines. So if you're using it for more than 10 minutes, because you can treat other areas throughout the course of the day, just give it a rest. But if you're just starting out, I recommend for chronic issues, maintenance, there's going to be different guidelines. So I'm going to have Lauren post that in the comments today. And instead of referring it to, sometimes it's not pain. Pain is one of the biggest reasons you want to understand the benefits of red light. But I haven't even talked about pain. I've been talking about all kinds of different things today. Maybe you've got a painful cold sore. Maybe you've got a headache. They can be used for pain, but they're also used to accelerate the healing of wounds, reducing the appearance of cellulite and scar tissue. So I've kind of revised this, and I've given you for high intensity devices a more general guideline. If you're using this for about the first week, keep your treatment time to more frequent, shorter sessions, especially if you're using it for pain. I'm going to get to questions here. I love your questions, Sunscape. And I was just about to talk about that, but I'm not going to get distracted because I will ramble. I'll get to questions. And again, if you're joining me today, we're giving one of these away. Launch price today is $149. I think regular is about $199. You're going to see these devices for anywhere from $200 to $300, $400 in some cases, depending on the brand. LifePro, of course, has a lifetime warranty if you register within 7 days. So please make sure you take advantage of that. But if you're familiar with red light therapy and you've been using some of LifePro's tools now, there's really never one device perfect for every application. The panels, the saunas, some of them tend to be better for whole body or larger surface treatment areas. This is going to be perfect for short, precise treatments. A cold sore, a pimple that you're trying to clear up before you go for a date on the weekend. Maybe your cat scratched you on your nose. I've got a horrible scar when I was a kid, a cat scratched me and it wasn't the scratch, but I kept picking it. So whenever I get really tanned, I've got this white line down my nose. So for scar tissue, whether it's new or old, if you have had recent surgery, sometimes you're restricted from doing activity. You don't want things to reopen, but red light will not only accelerate the wound healing, but it's going to help mitigate the development of scar tissue, which is really critical in that first, right after surgery up to about 4 or 5 weeks is when your scar tissue is developing. So these type of tools are going to be, maybe you've had carpal tunnel. There's all kinds of different little micro surgeries that you've had, and this is a good tool to target a specific area. And you can use this in combination with other things. So if you're using your Red belt for your waist or weight loss while you're on your vibration machine, this is just another tool, but more specific to treating a targeted area. I think you're going to really enjoy this. If you're my seniors out there, perhaps you're using the new infrared glove. You could use this to work on the wrist or an area on the neck. It's very light and a very, very short treatment time. So you're not going to have to hang on to it for a very long period. I'm going to set this back up here so I look like a game show. Again, we're giving one of these away at the end of the session. I want to get through some questions, but I want to give everybody who's here with me a chance to enter the giveaway. So if you're just joining me, you need to make a comment. Tell me where you're from. If you're using red light now, if you plan to, what you're using it for. I always love to, you guys, these products have been out a little while with Lifepro, so there's got to be some feedback out there. There's sometimes hearing it from me all the time. To you, I'm just the salesperson. But by commenting and letting someone know that you're getting relief from your arthritis or some of the results that you're seeing, I'm excited about a lot of things. But there's so many different ways that you can experiment with light technologies. You may be experiencing other benefits that might encourage someone to try something versus going for that next cortisone shot. I love and get very excited about non-invasive alternatives for you guys. So let's start with questions. I've got a few here, and I want to make sure I said hello to everyone who's commented. Hello again, Irene from New Zealand. I'm not sure if you've gone to bed yet. Alicia, hello. Thank you for joining me. Sherry, hello from Washington. We've got Bertha. She loves her Lifepro products. I hope you're using some red light now. I have Palomares. I hope I said that right. From California. I love your LumiCure. So if you're loving the LumiCure, you can relate to what I'm talking about. It feels a little bit lighter than the Torch. And it is a little bit different in the design. So you can't get this. This isn't just a separate attachment that you put on your LumiCure. It's a separate tool, but it is going to be nice for targeting specific areas. If you enjoy your LumiCure now, you're going to know what I'm talking about, how easy it is to hang on to and what those accelerated treatment times are like. Debbie as well, great name. Hello from Virginia. She's using the BioHeal pulled back muscle. I love the BioHeal. That's another really versatile tool. You can use it for other things, but I think you can understand. You're not going to use it as effectively if there's somewhere you want to target specifically, and you can do a quick treatment with these types of tools. Hello, Bertha from Pennsylvania. I have Sun Scorpio. Hello. Lynn just purchased a LumiCure. Awesome. Let us know how you like it. It's a great tool. I really like that, and I'm going to love this just for their portability. They're a perfect little on-the-go tool, and I'm very impatient. I don't know if you get that from me. You can never sit me still for 2 minutes. So I really enjoy my LumiCure for short, I need results right now kind of things, and I'm going to enjoy this as well. Dolores, hey, Debbie from West Texas. That will be great for some acne spots. That's kind of what I'm thinking. I like using the LumiCure or the VisiCure for more, total face for my wrinkles. But, I'm 50 now. I'm going to say that again. I've got a couple of tough ones that I'd like to do a little bit more on that area, but maybe not the whole face. So I think it's going to be a good compliment for that. Cheryl from California, I'd love to win the new BioCare. I'm going to start tripping on my bios. I have several specific spots that would benefit. Exactly. This is one of those tools where you could use it for other things, but I think it's going to be really handy for targeting specific tough areas that you're seeing improvement in, but you want to target it on that specific area. Hi, Debbie from Minnesota again. Sun Scorpio. Tish from California. We have Karen from Arkansas. Wait, oh, Karen from Arkansas. Facebook user, is this stronger than the large red panel? I wouldn't say stronger. I would say the diode itself is different, and it's a different purpose. So this is designed, it's more intense, it's designed for a shorter treatment period, whereas your BioHeal is more encompassing, it's a longer duration. You're going to use it for different things. So the biggest difference between the two, with your panels, your bulbs, they're going to be more of a total body, sitting beside you, or you're holding it a distance away. This type of a tool is a shorter, more accelerated treatment time, and it's going to be for a targeted specific area. But if you've got the BioHeal panel, start using it. If you're not, and what I'm talking about is perhaps you're maybe giving another area a couple of minutes attention with this accelerated tool. What about denture irritations? I would think so, Dolores. I mean, I'm very logical. I'm not going to go find a bunch of studies about how red light has improved, because they've already told us that it accelerates wound healing. So, anything from a blister in your shoe to a wear spot on your denture, to me, logically, I think it's going to offer not only some pain relief, but it's going to accelerate the healing. What I would say, though, Dolores, if you're getting continual or continuous pain and lesions from your dentures, and there's not something going on, maybe it's just a period of time, something's going on with your gums. But if this is a continual thing, you need to go get your fittings checked. I'm sure you know that, though. Will it help with sunburn? I wonder if it would help with sunburn. I would think if you're dealing with current sunburn, inflammation, you probably want to stay away from heat. That being said, if you've blistered and you've gotten, you could experiment to accelerate from a healing perspective. But I would start with minimal treatment times. If it's going to give you trouble with sunburn, I think you would feel sensation almost immediately. So the sensitivity, if it feels too warm, stop use, but keep your treatment times minimal. And I think you may notice it's going to expedite healing. But make sure, what I do know with sunburn and my experience with red light therapy, make sure that the skin is well hydrated. It's really, you want to make sure in Canada, we're always dry, but make sure that you're, also using a topical for something like that as well. Thank you for sharing. And some of this stuff, science is great at validating some indications, but it's the experimentation, it's that anecdotal use. You get curious, and I haven't seen in the manual anywhere that it says gingivitis or pimples, but to me, it's kind of a logical thing I want to experiment with. I've been using the LumiCure to target specific smaller areas already, but I don't want to put it in my mouth. This gives me a little bit area. Not only can I see visually better when I'm targeting that area. All right. Make sure you're wearing your glasses if you're looking at the mirror in this, but I can see in the camera here, and I could target some of my troublesome teeth, because I do have some major teeth issues. What else? Like my lectures, always consistent, regular use is going to be the best way to use this tool or any of your Lifepro tools. And as far as recommended treatment times, I've asked Lauren, this is just my little sort of snapshot. If you're using the high intensity red light tools, I shouldn't say red light therapy, because the new LumiCure Pro offers other and infrared. You can't physically see that light spectrum. So I guess I wouldn't really put it, I think it falls under the red light spectrum, but this is a red light therapy tool. There's a variety of light therapy tools. And what I want to say with the LumiCures and with this new BioCare, you want to make sure that if you're just starting out, especially with chronic issues, pain, lesions, keep it at a minute to 3, maybe for the first week. If you're noticing improvement, give your body time to kind of get used to this. It's not about going max time all the time. We all do this. We think more is better. But just because this thing runs for 10 minutes does not mean you need to use it on that single area. Use it for a minute, 2, maybe 3, especially if you're dealing with pain. If you're sensing some relief, leave it and do another treatment later. I'd rather you use shorter, more frequent treatments starting out and extend times once your body's had a chance to adapt and get used to this new technology. If you're using it for chronic issues, couple 3, 4 times a week maybe. And if you're using it just as a maintenance, as a, you've gotten rid of something, don't stop using it. Keep using the tool to keep it away. That prevention goes a long way. But you might only need it a couple, 3 times a week on a maintenance piece. So, whether you decide you want to go less often with longer treatments, that's kind of part of your own experimentation with these devices. But absolutely, when you're first starting out, shorter, more frequent treatments, 1 to 3 minutes. By the second, third week, you could extend that out to maybe 3 to 5 minutes and see how you make out and build from there. Thank you for posting my cheesy links. We do need them all, Facebook user. If you've commented and your name comes up as a Facebook user, please make another comment with your name so we can get you at least entered with the draw. We're getting to that point. I'm going to keep going here. I use the LumiCure for my pain in my neck. Would the BioCare be more specific therapy device for neck pain? I think the LumiCure is good, but if you have another specific, you could kind of use 2 at the same time because they are so little. You could have one on one side of your neck, one on the other. But I would say this is going to treat a more specific area. The LumiCure is going to be a little bit of a bigger area, but I would feel more comfortable using this in the face region than the LumiCure, just because of it's a bigger display. So I just want to be really cautious if you're using the LumiCure or the LumiCure Pro around the face. I think this would be a little bit more ideal for treating, like I say, cold sores as it's been designed to do. But of course, my curious brain is also thinking those pimples and those areas on my face that I wanted to target, but have been a little reluctant maybe with the LumiCure. So I hope that's not too crazy of an answer for you. I love the fact that you can pinpoint an area. I hope that makes sense, Brenda. Hang on, I've gotten new comments and I have to scroll back. Again, thank you for the birthday wish, Brenda. Hello, Kim. I use the LumiCure pain for my neck. We covered that one. I love the fact that you can pinpoint an area. Thank you, Brenda. I've doubled back because I got some new comments. Denise from South Florida. Hello. My husband gets cold sores in his mustache. Ooh, that would be an awesome example. You could wedge it right kind of in there, if you know what I mean. For carpal tunnel, your carpal tunnel pain is better. That's another miraculous reason. Whether you're dealing with carpal tunnel or you've had carpal tunnel surgery, it can be treating the symptoms, but it could also be treating the scar tissue and other things, skin surface and within. I love my red and my near light therapy devices. They really do what they say. You must be using it consistently, Dolores. You'll get those results if you just use these things regularly. If you have a LumiCure, can you buy just the attachment? No, it's not exactly the same. And I brought that up because I knew that the LumiCure is a little bit different in the diodes. This is specifically designed to go with this, although the housing, it's probably the same design, but this is designed to work specifically with this tool. And I don't know that I want you taking it apart and putting it back together all the time. So this is specifically kind of more designed to go with the tip. I have the red light belt. I use it on my back, herniated disc. I'm from Colorado. So the red light belt is great for the back. You do want to treat that whole region. So for example, you may have a herniated disc. That's a small pinpointed area and someone could assist you specifically, or you could, but you still want to treat the whole spine if you've got your belt, because it's compensating for that disc as well. So even though you've got issue in that one area and you could use this to pinpoint it, you're going to need relief through the entire area. And you'll probably want to use that belt on the hips too, just because of how our body compensates for that weak area, that weak disc. I would love to win this. My son gets terrible cold sores. And yeah, if you do have cold sores, you may then you're using it specifically for that. Then you're not using it on your neck. And make sure that you clean it as outlined in the book if you're using it for something like that as well. I've never used red light, but your thorough explanation of this unit makes me want to try it. And I haven't even explained all the benefits. I rambled off on a tangent. Yes, I've talked a lot about wounds and skin surface things, but why? It boosts circulation. It's going to help you manage your pain, your swelling, your puffiness, cold sores, wounds, pimples, sunspots, scarring. It's going to expedite healing, surgery. If you've had some, if you're getting ready for it, bruises and scrapes. There's all kinds of reasons that we have injuries and lesions on our face. Reduce fine lines and wrinkles. I brought that up because I know many of you are using the LumiCure, and we as women, Yes, of course, we want to know about the beauty aspects of this. And like I said, I've got a couple of really tough ones that I without surgery, I don't know that they're ever going to completely dissipate, but I can, specifically target those or give them a little extra attention in complement with my Visicure. I also sometimes use my BioHeal panel when I'm too, when I don't just specifically target the face. I like using the BioHeal panel because it gets my face, but it also gets my achy shoulders and other things. So again, there's never going to be one perfect device for every application, but if you are paying attention to one particular area, sometimes getting a complementary or specific tool is a great idea. Headaches, I mentioned that's something. If any of you, maybe you're experiencing an improvement in headaches and just never even really paid attention to it. So if you're using red light therapy now, it doesn't matter if you're treating your waist or your shoulders, you may be noticing those effects already. Teeth and gums. I'm really curious. My niece is a horse dentist, and she's been playing with the BioHeal, not the BioHeal, whoa, the BioLux, which is the handheld device on Amazon. But this is going to be great. Maybe just getting into some specific areas, so I might be letting her play with that a little bit too. And to me, does it say use for teeth or gums? LifePro is not here to give medical advice. But many of you are asking these questions because you're good consumers and you're doing your homework. So of course you have questions. So to me, logically, if you want to use red light, it's not a matter of what specific frequency or what you're looking at. It's make sure the tool makes sense for what you're planning on using it for. And this is one of those tools, like I say, to me, it's a logical thing that I'm going to experiment with in a few areas. And I encourage you to do the same. So we're going to start drum rolling. If you haven't made a comment, I'm getting to the draw. I just ordered the belt last week, waiting for it to arrive. I'd love to hear some feedback on that. Hello from North Carolina. Just received my first red light yesterday. Was surprised it helped some already. That's awesome. You're coming up as Facebook user. Let me know who you are. Maybe you might win a second one. Facebook user also. I'm in Pueblo, Colorado, and I own the wand, light, and panel devices. I use them for hand pain and hip pain. Awesome. I'm glad you're seeing these benefits, and that tells me you're using it. That's really the only secret ingredient here. You can't really overuse red light, but you don't need to spend hours doing it. That's the beauty of some of these accelerated tools, even under 5 minutes on many of them. The BioCare looks divine, especially for sunspots. I have so many LifePro products and I use so many of them regularly. I wish my funds weren't so limited. Get creative with what you've got. And, these are just other ideas when you do get to that point, or maybe there's a sale. This today is on for $149. You may win one. But, I'm just giving you guys ideas. I know once you start working with red light, you start getting experimental. And if there are areas, usually there's smaller areas, especially on the skin surface that you're trying to target. This is just another tool to give other ideas when you do decide the time is right. Would this work for clogged pores? Nancy, I think that it might. Logically, it might open up the pore. If you've got something tough, if you're dealing with, cysts or things, and you've got, I get cysts from time to time, and they tend to be a little bit more stubborn. I'm a picker. I'm bad. But I would think it might soften up the fibrous tissue inside there. I'd really love to hear if you're experimenting with that. But logically, the red light is going to open up the pores. Love my red light products. Use Lumicure for tinnitus. Love to hear that. This, I know I'm going to get way personal now, but you think I haven't thought about this too? What about the ears? You can get right in there with the light. Okay. Just ideas. From Wisconsin, using the belt for knee and leg pain, Visicure for fine lines and rosacea. Awesome. Recently started looking into red light therapy. Would love to try some on scars and soft tissue damage. I will say with scarring, if it's recent scar tissue, because I see really good results with the vibration plates with scar tissue, but it depends on the surgery. Sometimes you can't always bear weight. So I love the red light tools in complement to the vibration plate, especially where you're unable to bear weight. Anything that you can do post-surgery to mitigate the development of that scar tissue, the less it's going to be a problem down the road. For those of you that have old scar tissue, you know what? I'm noticing I have this big one from a motorbike accident on my leg, and it looks like a Nike swoosh. And in the summer, it's white. You can see it on my leg when my legs are tanned. But I've been playing with the belt and the panel, and I noticed the scar, it kind of dips in. It's softer, it's squishier. So I think it is doing something to the older scar tissue. So logically, it may do things to scarring on the skin surface. But I think with older scar tissue, don't be frustrated if you don't see results as immediate as other benefits like swelling and pain. I think with older scar tissue, it's probably going to take a little bit longer for that circulation and lymph to do its magic. I have terrible balance spots on my face. I think you might notice this is a good tool. If you have red light now, use it for those things. We don't always think of, that's not always the reason we bought it. So we don't always think of the other things we can use these tools for. Cindy from PA, I use the Aleva Red back or belt for my back. Common fave use. I love using it seated in my chair for that reason. I've been using the Lumicure on my carpal tunnel. Haven't tried it on my face because of the larger area. I love how this is tiny and targeted. Again, I'm not saying what LifePro recommends. This is me as a person that's been playing with these 15 years. To me, this is a logical thing for a little more safer use if you want to, and that's at your own risk. I think this is an awesome idea for the face. You can use this if you've had skin cancer. Absolutely, you can use this if you've had skin cancer. If you want to do some digging into red light therapy and look at the article link, there's a lot of reasons that lasers and light therapy are being used not only for cancer treatment, but post-cancer treatment scarring, whether it's the cancer or the treatment that has scarred you. Absolutely. It doesn't have the UVA and UVB that the sun does. So sometimes we think, well, how can we use light spectrum? Isn't lights, they think that the sun has given you cancer, that the spectrum, whatever has caused that skin cancer, it's a different thing. Those spectrums aren't with the red light. I would love to win this. I use red light, Dolores, for my low back, DDD, sciatica, spondylolisthesis, and more. My Rejuvenate wrap blanket is so wonderful because I have pain all over my body. So you're a good advocate, Dolores. You know that there's never one tool. And if you're dealing with chronic issues, sometimes that changes from day to day. What's working today doesn't work tomorrow, or sometimes you need to change gears with your chronic issues. And these little tools to pinpoint target areas or troublesome areas are great for that too. I love this, love all the products. Great advice, shorter, more frequent use. Again, you're not going to use this for your weight loss or your total body treatment, but it's a great throughout the course of the tool day. For those of you that have been considering using that Lumicure on your face or your ears or your mouth, I think this is just a little bit more finely targeted than that. Light therapy is a game changer. Never tried this one, but I'm curious. I'm a PT, so I would have to have more tools to recommend to my patients. If you're a PT, again, I'm always thinking about, because my brain is always hardwired, how I'm applying it to other people. And this is a really good one if you are dealing with a skin surface issue or you want to warm something up, not only because you can pinpoint, but the Lumicure in this are great because it accelerates the treatment time. So if you're using it as, Heather, if you're using this as a pre or post treatment, with other treatments that you're doing, you're just going to get a more optimal outcome at the end of that. So maybe you're using this pre-cortisone injection. Maybe you're using it, like there's all kinds of different reasons. I always talk about combining the vibration plates, but where I love the red light therapies is sometimes they're more convenient and they're more practical in a practice situation. You should have all of them. That way you're versed for every situation. Lumicure is great on the neck. Marion Singleton, thank you for the info. Replying to Heather, and she's also in Colorado. Brenda, I would love to win this. Another product from LifePro. I'm so glad I stayed home from work today to be able to watch this. Oh, thank you for skipping work to listen to me ramble today. Facebook user Pat, I love the sales. This would be great for my tween who, I hope you meant sales. This is great for my tween and now facing spots on the face. You know what it is with the kids? Because I used to be one, but I'm not anymore, but I have them. You can't get them to do anything for 10, 15 minutes because they don't have the attention span. So my son, he's 18. He's in the next room. But the face mask, like 5 minutes in, right? But he doesn't always necessarily need to do his whole face. I wish that he would. I like doing my whole face because I got wrinkles on my whole face. But, sometimes when you need a tough one, it might be something he'd do. So thank you for suggesting that. You're dealing with a different demographic. I like the ear suggestion. It would totally be helpful for inner ears. I know that it would, Marion, and I'm not here saying that LifePro says to use this for your ear, but this makes more sense, right? Hope for Cancer, use red light. You know what? A lot of them do. I've got a number of different articles out there. If you want to do some more therapy, I would take a step back and don't just put yourself in the red light box. Light therapy for cancer, and you'll see a bazillion things come up. All you need to know is it's safe. So why wouldn't it be safe? It's specifically to cancer. I'll go there. It's going to boost the immune system. It's going to help your body detoxify. There's all other kinds of reasons that you would use it for that. This may or may not be the, if you're dealing with a specific area, but as a total body, that's where the saunas and some of the BioHeal panels, some of the longer treatment times are going to do a better job at detoxification and some of those total body effects. Thanks for the chance to win. I need this. The face mask is on my list. I love it. Okay. Lauren, I need a drum roll, and I need to give this away to some of these patient people that have been listening to me ramble. So thank you for listening to me go off on a tangent. Again, this is another amazing tool. This is not an attachment for the LumiCure. It is designed differently, so it's its own thing. But if you've been using the LumiCure now, you understand this new terminology that I'm bringing to the table of short time, long time, and it really depends. The benefits are different. The applications are different. And again, in theory, red light will treat any of the benefits you're looking to accomplish, but sometimes getting a tool specifically for what you're trying to treat is going to be a game changer. And you can absolutely use these in complement, not only with your other red light tools, but your other Lifepro products. So thank you for listening to me ramble. The winner today is Pat Campbell Rhodes. Pat, you are here somewhere. Sorry, I need some coffee. Nectar of the gods. I love my coffee. Is there a LumiCure attachment? No, it looks and the housing is similar to the LumiCure, but this is its own thing. For now, to my knowledge, this is not an attachment you can buy separately for the LumiCure. It is a different, let me show you here. It's a little bit different on the inside, and there's a cap here that you'll remove to insert this to use it. So it is a different deal. So this is a separate purpose to the LumiCure, but the reason I raise that is it's also a short treatment time. So this new BioCare tool and any of the LumiCure tools are designed to be shorter treatment times. When you're starting out with these, I recommend 1 to 3 minutes, maybe for the first week, and use them more often. Extend that maybe 3 to 5 minutes once you've gotten a little bit used to it. It is preset for 10 minutes. Please do not use it for 10 minutes first time off the bat, especially if you're dealing with a severe issue. Use it more often, but you can treat other body parts or other areas. If you're planning on using it for more than 10 minutes in one session, please allow your BioCare or your LumiCure, just give it a break. It's going to be warm. You want to prolong the life of your investment, and make sure that you, if you are considering this tool, you register your product within 7 days to take advantage of the lifetime warranty. So again, congratulations to Pat. I'm very happy that you have a new tool to play with, and I'm looking back to have some feedback on that. Yes, there is a link to purchase down below. You'll see it there. If you're considering this, as I said, it's on for $149. It's relatively inexpensive. The regular price is still $1.99, and I think you're gonna, as I said, see similar devices for probably the $200, $300, upwards of $400 mark. So $149. Go directly to Lifepro's site for the best price. And of course, my link is thank you again. My link has been dropped there if you want to find this new tool on site. Thank you so much for joining me today, guys. I look forward to joining you next Monday. We're going to start switching up on Mondays. I'm going to be doing more of a live Q&A because I do tend to be so informational with my sessions, and you guys are just so amazing with the questions that you bring forward to me. So I would like you to join me at my regular time next week on Monday at 3 p.m. my time. 5 p.m. Eastern time, and we're going to be doing much more of a Q&A style, and I'm going to be doing a demonstration of a protocol that Lifepro provided for Dr. Terry Walls, Lifepro partner. She's done some amazing work in the self-care department with her own struggles dealing with MS. and Lifepro has been an integral part of that. I'm going to go over a whole body vibration plate program that I was privileged to be a part of for Dr. Terry Walls and her Walls Warrior protocols. So I'll be going through a session next week. I look forward to joining you then. Congratulations again to Pat. Thank you, Lauren, for all your amazing work behind the scenes, as always. And I look forward to seeing you guys next Monday. Don't work too hard and use your devices consistently. I'll be checking in more regularly on you guys. Take care.